Hi, this is Marquita and welcome back to Healthy Living. Okay, you can reach me at marquita.com, that's markeita.com, or you can also reach me at healthyliving.company. There on my websites, you'll see I have several different things. I have different products. I have ketozatos, gumbo, and also the Arbonne link is there to take you straight to that one. I'll go over that briefly in a few minutes. But if you want some of the food products, you have to send me a message so that I can make it for you fresh. So you can also contact me here at Next Level Studios at 310-549-1113, 310-549-1113. You can also call in when I start talking about the coronavirus if you have questions. So you can call in today and you can ask questions. And my producer is T-Jams. That's T-J-A-M-Z. And you can reach him at tjamsmusic.com. There on his website, he has several different songs. You can write lyrics to it, send it back to him, send him a message. He also does web design as well. So he does all of those different things. You can send him a message, or you can also contact him at the Next Level Studios at 310-549-1113. So be mindful. You can call in if you have questions about the coronavirus. I'm going to give you the bare truth, and I'm not going to hold any punches back. So first, we're going to go ahead and do a few things about nutrition to help keep you safe and healthy, because you have to eat healthy to help build your immune system to help you for the coronavirus disease. Now, we have a 30-day and beyond pack for Arbonne products. They are pure, beneficial, no soy. Soy, remember, it mimics estrogen, so we don't want that because it can cause cancer. Men can get breast cancer as well, so we want to stay away from soy products now. So with that plan, you get a study guide, and it's 30-day and beyond. You can use replacement shakes. We have chocolate and we have vanilla. So you can use replacement shakes for 1 or 2 times a day, depending on how much weight you would like to lose. Also, you have to make sure you're using the right milk. You want to stay away from cow's milk because, well, that's for cows, not for us. You want to drink almond milk, cashew milk, rice milk, coconut milk, there's sheep. Those are the type of milks you want to drink with your everyday life. So change that up and get your kids off of that cow's milk. And no child should be drinking 100% milk. Why? We have an epidemic of obesity. So we don't want to give them 100% milk. If you want, and if they're lactose intolerant, you can also give them lactose intolerant milk. But make sure that you have the right milk products. You can order online now, and even with the frenzy that's going on now with the coronavirus, you don't have to stand in those long lines for 3 hours. That exposes you to close contact. You can order online to get some of your supplies. Just know it may not be your favorite product at the time or your brand, but you can order online. You have to keep at least a 6 feet distance from anyone to stay safe. So with this 30-day and beyond, we also have fiber. We have fiber boost that comes with that. And you need to make sure that you're having a bowel movement at least 1 to 3 times every day, not just once a day. 1 to 3 times a day. So if you're not doing that, you need to add some more fiber to your diet. So you can throw that in your protein shake as well. And we have a protein shake cup. You can also have these individual packages that you can take with chocolate or vanilla, and you can be on out your door. Now, another thing I do is I usually mix berries. You know, blueberries, raspberries, and blackberries. Those are very healthy berries for us. So what I do to save time, you can blend them and put them in ice cubes and freeze them. You can pop them in your shot cup, because it has the ball there, and drop it in your shake and you'll be out the door. It's wonderful. It starts fusing together and it's wonderful. You can also rotate the different types of fruit, you know, orange, apples. You can add vegetables, cucumbers, avocado, kale. You can do all of these different varieties of shake with vegetable combination, with fruit combinations, or both, or you can just change it out. So whichever one you want, it's all healthy and it's better for you. Now, also with the 30-day and beyond plan, we have what we call fizz sticks. Fizz sticks come in citrus as well as pomegranate. So there's 2 flavors. So instead of drinking all that coffee that shoots you up and then drops you down after about an hour or so, you want to drink something that's a little more healthy. So we have, with our Arbonne products, they come in individual envelopes, and they're B vitamin. So I usually just take a water bottle, and you just top it off. And then what you want to do is just drop it right into your bottle, your water bottle. And then, as you can see, it calls fizz sticks for a reason, because it does actually fizz. So you want to make sure you shake that up and drink it throughout. Drink it, and your level will come up, and it'll sustain you throughout the day. That's fantastic. And it's natural. It's none of this artificial caffeine to speed you up. Now, the other thing that comes with that pack is what we call Fitz Chews, which is another type of fiber. It comes in lemon, caramel, and chocolate. So you don't want to just leave it on the table for your children to eat, because they can eat too much because it tastes that good, right? So then they can get diarrhea. But you can give them one if you want to help them with their, make sure they're not constipated, because you want to start checking their stools. It shouldn't be rocks and balls. It should have some type of shape to it. Otherwise, that means you're constipated. So check on your children to see how their bowels are moving. Also, we have Digestive Plus. You need good prebiotics to make good probiotics. 80% of our immune system is right here in our gut. So if we have a lot of fat around our gut, that's very unhealthy. So we want to make sure we get rid of that gut. That's the most unhealthy fat. Also, we have Herbal Detox Tea. Now, the Herbal Detox Tea, it detoxes our two primary detoxes, which is our liver and our kidneys. So why not have something that's wonderful and warm to help get rid of some of those toxins? Actually, proven research shows that if you drink a warm drink with your meals, it helps to ease the digestion along. So you have several benefits by drinking the detox tea. Also, we have a 7-day cleanse that come with that, and you take the pills for 7 days to help guide you along to get rid of those toxins that are built up in your system. Now, we also have those protein shakes are 160 calories. We do have protein bars that are cranberry and pumpkin seed. We have chocolate and sea salt. And these are 170 calories. It's an excellent little snack when your kids get home. You want to make sure that you're not feeding them a full meal when they get home and then turn around 2-3 hours later and give them a full dinner before they go to bed. That's just way too much calories. So get them a snack. Have a wonderful bowl of fruit and vegetables for them to grab and eat. There's also good fiber in fruits and vegetables. So that's another way to encourage your kids to eat fruits and vegetables, but it also helps their bowels. Now, if you get an apple, green is better. It has more fiber. But if they only have the red apples, that's fine. It's still healthier than eating a bunch of junk like cakes and cookies and breads. Because breads will fool you because it breaks down into several teaspoons of sugar. So you want to stay away from those breads. And make sure the breads are brown. You want to do brown with your food colors. Same thing with tortilla shells. Same thing with brown rice. You want to go brown. The white products have no nutritional benefits because it's all refined out. So brown is more healthier. It also helps you to feel fuller sooner than the white rice and the white flours that they use to bake, because they want to make the donuts and everything more fluffier. But you tend to eat more of that because it has no weight, nothing to make you feel full real quick. Now, another thing is don't eat too fast. If you eat too fast, you're going to eat 3 to 4 times more than what you should be eating. So slow down. You also want to make sure that those nutrients are chopped up fine so that your body can properly utilize your nutrients. So the other thing, you want to make sure you sit with your kids while you're eating, because it helps to slow them down. And make sure that they are eating the right portions. And I'll go into that in a minute. Now with Arbonne products, we have everything for your day-to-day. We have women packs, men pack vitamins. We have kids vitamins. We have all your daily care. We have several lines. We have the RE9 line for our older generation, for the age spots and the puffiness under the eyes, and just to moisturize your skin properly. We also have several different lines, and one is the FC5 line, which is several fruits and vegetables, strawberry, mango, and a few other ones. Those are pure fruit and vegetable sales. Also, it's very important to stay hydrated. You need to have at least 64 ounces of water a day. Make sure, especially with the coronavirus, things are going on, you need to stay hydrated. So stay hydrated, but don't overhydrate, because you can also throw your calcium and potassium off, which impacts your heart, and you can have a heart attack. So you don't want to do that. We have to have a balance in our electrolytes, okay? Now, another thing is we have greens. You can throw greens into your protein shakes as well, because you're supposed to have about 5 to 6 servings. And it's hard for us to do that, but you should have 5 to 6 servings. Now, another thing I wanted to let you know about, we have shea butter line. We have another fiber line we call the Full Control. Also, we have, with the Full Control comes the vitamins with thiamine in it. Thiamine helps to increase your metabolism. So if you need your metabolism increased, you need to have the thiamine with it. Now, we also have a sensitive line. We have a detox line. We have a full makeup line with powder and liquid foundation. We have rouge. We have eyeliner. We have mascara. We have lip gloss, lipstick. We have CC cream. Everything you can imagine, we have that for your daily use. Now, for the men, you're not left out. No, no, no. We have a pre-balm for your shaving. So what you want to do is use the pre-balm first. It helps to keep the hairs from going back into your skin, causing the bumps. Then we have the shaving gel, and the after balm to keep your skin from getting red and irritated after the shave. We have that for men, and also for the older men, we have the RE9 for you as well. There's soap, there's deodorant, there's cologne, everything you can possibly think of, we have that with our bond. Now, another thing, I know people are worrying about shopping. You know, you want to get the staples, you know, like your rice, your beans, canned goods, non-perishable goods, bags of things that you can just eat. That's the kind of things you want to get. So if you want, my suggestion for pinto beans is, I like to do cooking in a crock pot. So if you're going to do that, you have to make sure you pot boil your beans for at least 10 minutes in order to get rid of the lectin. Lectin causes an irritation in the GI lining, and it also lets toxins spill into your system, which is what we don't want. So pot boil them for at least 10 minutes and then put them in the crock pot, unless you continue to cook them on the stove. So that's just another FYI with that. Now, I want to teach you something about serving sizes. This is important. Half of your plate should be fruits or vegetables. Half, yes, half of your plate. A lot of times, people are eating more pasta, complex carbohydrates. Pasta, rice, beans, spaghetti, noodles, all of that. You shouldn't have that much. Matter of fact, that should only be 1/6 of your plate. 1/6. And then you should have 1/4 of your plate with lean protein. Chicken, fish, turkey. If you're going to eat beef, make sure you try to get the highest lean percentage and that they're grass-fed. And like I said, nowadays, you can order your groceries online. It may be a little wait right now because of what's going on with the coronavirus, and people are panicking. But don't worry about it. Just order your stuff. I ordered some yesterday. It's coming March the 2nd. So it's coming. So don't panic. The other part of your plate is 1/12 of healthy fats, guacamole, avocados, cashew butter, almond butter. All of these are your healthy fats. Now, I want to tell you something about bowls. You know how moms, you say, oh, the bowl is the cure-all for everything. You just grab it and go. Remember what I said, complex carbohydrates is only 1/6 of your plate. When you get a bowl, 3/4 of the bowl is rice. Now, some establishments have changed. Some have brown rice available, but you have to ask for it. I don't know how much you're going to be doing outside, picking up food. Right now, I'm going to be cooking inward. But in case you do, I just wanted you to let you know that. And then what they do is they top it off with a little bit of vegetables and some chicken or beef or some kind of meat product. So here we go with the bowl. Wow. So you can see I'm having a hard time keeping it on the plate. So there's no way that anybody should be eating this much food, especially kids. That's way too much food, and they eat too fast, so they wind up eating more than they should be eating. So parents, you as well, sit down with your kids at the beginning of the meal. Make sure you're not eating too fast so they don't eat too fast, because that's how you eat more than what you should be eating. Remember, it takes time for the brain to tell the stomach is full. So parents, we need your help in this. And then also, if your child is already overweight, you want them to eat their fruit instead of drinking their fruit. If they're overweight and you transition them off of juice, you can take 4 ounces, but dilute it with water just to start transitioning them off of the juice. Okay? And if you do, don't do no more than 2 times a day. You want to decrease it, but remember, it's diluted. Start giving them fresh fruit, giving them more options. Fresh vegetables, carrots are good with the ranch and celery sticks. That's more healthier for you and your children. So I want you to know about that as well. Now, let's get to the meats and potatoes of the show today. Okay, we're going to talk about the coronavirus. And I'm going to give you the truth about the coronavirus, whether our management team is ready to listen or not. So the healthcare providers like myself and my peers, we're more vulnerable because we take care of the patients. We're there on the front line. So we're going to be exposed to them. So what I want to do is tell you most the information I retrieved from the show today is from Cal OSHA website, which is the California, it's the Occupational Safety and Health Administration. They give us guidelines and rules to follow to keep us safe. And these are laws. These are not little policy. These are laws. Also, the information was retrieved from the CDC website, which is the Center of Disease and Control Prevention. And also some of the updates come from World of Media to get the current numbers. So let me give you some current update on numbers. Now, per the World of Media, this is Saturday, March 14th. Now, as you know, numbers are ongoing, changing as by the hour even. So this was yesterday evening. The numbers confirmed reported it's 160,000 cases and 6,000 deaths. This is worldwide. 160,000, 6,000 deaths. And you know what? It's going to keep happening because everybody's not tested. There's certain requirements that limit testing. There's also limit testing available. They don't have enough. So they're now scrambling trying to make enough tests so everybody can be tested that have the symptoms. Now, most active cases are in Italy. They have 18,000 cases. They just went rampant in Italy. It's just amazing how many people have it. 18,000 cases, 1,500 are considered critical or serious condition. So we're going to have to pray for everybody, but some of them may also die later. So I'm hoping that doesn't happen, but it's just the reality we have right now. According to the World Meter, out of the total cases, at least 73,716 patients have fully recovered or discharged from different facilities. Now, 65,573, now that was in China. And on the ones they have the most on record is like 80,000 persons in China that was affected. That's a lot of different people. Now, according to Channel 7 this morning, around anywhere from 10 to about 1 o'clock, they said there are 60 deaths, nearly 3,000 cases in USA, in America. That's a lot. 60 deaths and 3,000 cases. So when Donald Trump was talking about, oh, it's not going to happen, it's Democratic hoax, it was a lie. And we knew it was coming as medical professionals, but we are still not prepared. Now, LA County has 12 new cases. This is if you're in California. We have 12 new cases. And last night we had 54 and we had 1 death. So also Riverside and Orange County have 14 cases. San Bernardino has no cases at this point, but they're also not testing. So this number is definitely going to change once more testing occurs. Now, according to the CDC, the symptoms include anywhere from coughing, sneezing, runny nose, fever of anything 100.4 or higher. Also, body aches, or if you're having a hard time breathing, right? That's when you need to get help with that. Now, what people are not telling you is that someone who has the coronavirus, if they're talking, you can get the virus from them. If they're exhaling, which we all do, we breathe in, that's inhalation. Exhale is when you breathe out. So you can also get the virus from talking or exhaling. So whoever has it and you talking to them, that still exposes you and make you vulnerable. But of course the news is not telling you that, but I'm going to tell you the truth. If you have the symptoms that I mentioned earlier, you know, with the cough, the sneezing, the runny nose, the shortness of breath, also fatigue and tiredness, weakness, then you should call your doctor. Or if you don't have a doctor, you want to go to a particular ER, make sure you call ahead so that they can prepare for you. Now, when you get to the ER, more than likely, if you're having symptoms, they'll put a little surgical mask on you, if you're the patient, right? The nurses will wear an N95 mask. At least that's what they should be wearing. We do have a shortage right now, so it's limited, but N95 masks are really recommended for the nurses. And you should always have on your gloves as well. They also recommend that you have the goggles, the face shield, and the gowns, which is not happening in a lot of the facilities, which is putting us at jeopardy. Now, also, the new World Health Organization announced on March 11th that we are officially considered a pandemic. Pandemic. It's across the whole United States and other continents. New cases now in Africa. So it's everywhere, everywhere. Now, the virus, which was first reported in Wuhan, China, Wuhan City, China. So everybody knows about that. That happened December 2019. So far, the spread has spread it to 114 countries and territories around the world and internationally. New cases, like I stated, in Africa. Now, if they would have prepared ahead of time and not thinking that it was going to come to the U.S., then we would have had enough supplies. But they didn't do that. Some communities impacted, this is what they're doing now. They are now shutting down the schools. At first, the private schools shut down early last week, and now the public schools, they're shutting down as well. So Monday, your kids would not be able to go to school if they're school age. Now, I know within LA County, they're allowing you to use your leave bank to stay home and take care of your kids if you don't have babysitters, because that's what happens, right? A lot of people use the schools for babysitters while you're working. Then you go pick your kids up. Now, another thing that's happening is they're closing down libraries. They're closing down jury duty has been suspended, so it's not going to happen anymore. There's several small and large businesses that are closing down. Some are closing down because they don't have customers. Others are closing down because they want to make sure everybody is safe. They're closing down amusement parks as of Saturday or Sunday, I think, 1 or 2. It was the last day you can go to Disneyland. So a lot of the amusement parks are closing down. The ski resorts are closing down. Restaurants, several small businesses throughout the different counties in the different worlds. Now, over in Italy, they had shut down the whole community. I mean, you're talking about millions of people shut down. So they're all shut down. No one can exit. So this is because they're the one who have the largest rise in the coronavirus. Now, because of this shutdown, some businesses, they're not going to be able to pay their employees. But some of the good things is some of the athletes are stepping up with the arenas, because the sports, a lot of the sports activity, they have been suspended or not at all for the rest of the year. So a lot of the players, it's their home arenas, they're helping the employees, which is wonderful. They're millionaires. That's great. That's what millionaires should be doing, is helping their communities. Now, CDC and Cal OSHA, everybody recommends maintaining social distance, meaning at least 6 feet away. Now, I don't want you to panic, but you don't shake hands, just like our president. Please don't follow our president. He's modeling the wrong stuff. He's on TV shaking hands, and we don't shake hands. That is one of the ways you can get the coronavirus. People who have it, you know, they're wiping their nose or blowing their nose or they're coughing in their hands, and then they want to shake your hand. So the president is a bad example, so please don't model after him, because according to him, this has been Democratic hoax for all of these months. And now he got exposed. Finally, he went and got tested. He tried to deny it, but it was pictures, it was media, and he finally got tested. He claimed he's negative, but, you know, the president lies so much, I don't believe nothing he says. Okay, so the coronavirus, there's other coronaviruses in the past, so it's not new. It's just this particular strand is new. That's why it's novel. Novel means new. But in the past, we've had SARS, which is the severe acute respiratory syndrome. It's a coronavirus. Also, we had MERS, which is also the Middle East respiratory syndrome. So those are coronaviruses as well. So this one is a new, different strand. That's why it's Nova. So there's a lot of things that they don't know about the coronavirus, but China's had it since December. So why aren't we patterning some of the things that they do and safe precautions that they're doing here? Why do we wait till people start dying and start developing cases? We need to have the best practices and utilize those best practices. It should have been early on. Now, at first they said that the transference of the coronavirus was from animal to person because they had a lot of live animals in open fish markets. But then they found out that now it's person to person because people started contacting. They had no exposure to the animals and they weren't in the market. So now it's, and even now, it's more community, meaning it's in the air. It's in the air. And I don't know why they won't accept that, but it is. And I'll tell you more about that when I get to that. They're shutting down different travels from Europe and China right now. The president shut that down. Now, the ones that are more vulnerable are 65 years of age or older. So also people with severe underlying health conditions are more vulnerable. People with heart disease, people with hypertension, chronic respiratory disease or lung disease, cancer, people with diabetes. These particular populations are at higher risk. And if you notice, a lot of the people who have passed or died were like in their 80s, 70s, or had multiple different chronic disease processes. So you have to be careful out there. But I don't want the young people to think, oh, it's not going to bother me, because you can get it too. So don't be out there acting like, oh, I'm invincible. And then the other downside to that is you can bring the disease home to your vulnerable parent. So you could be a carrier. So you have to stop taking those stands that, oh, I don't fit the criteria, but you could be a carrier. You can also be carrying it and don't even know you're carrying it and still expose people to the virus. So I need people to stop that because it's inappropriate. Now, respiratory precautions are mandatory to protect healthcare employees from airborne infectious disease like the novel pathogen. Now, this is from Cal OSHA. CDC says the same thing. This particular pathogen is what we call it's aerosol, meaning it's fine mist, it's in the air, and they don't know how long it stays in the air after someone sneezes and coughs, but it stays for a long time. Significant. We don't know. Maybe 8 to 12 hours, but we don't know. So if they're there and they're coughing and then you walk in it and you're not protected, that potentially sets you up for that coronavirus. And I truly believe this is why the coronavirus is spreading so quickly. But our managers and our departments are not saying the truth, and neither is the media. But this is what the truth is. Therefore, employees must be provided with the appropriate respiratory protection at all times in order to control and eliminate employee exposures to airborne infectious disease. What this means is like TB. If TB is out there, it's airborne as well. It's aerosol. So when you cough, it's in the air, right? It's the same type of disease process as far as how you should be handling it. Now, respirators must have filters that remove at least 95% of the airborne particles, which is why we call this N95. This is what the nurses should be using, and this is not being provided to all the nurses everywhere. There's a shortage, but this is what needs to be provided. Now, so it should be an N95 or more, greater, not less. The surgical mask is less. This is not going to protect you from the coronavirus. Why? This fits on your face. So and everybody has to be fit tested. Everybody's face size is different. So this keeps particles from coming into your mask. This doesn't do any of that. This is open. So it can easily creep under the mask. Now, the National Institution of Occupational Safety and Health, under Cal OSHA, aerosol transmitted disease, we call it ATD, but that's what it means. And it's under Title 8, Section 5199. So you can look this stuff up for your own self for your when you have your own time. A novel virus such as the coronavirus, they call it SARS, Corona, or COVID-2, and some call it COVID-19. It's the bottom line is new, and it's considered an airborne infectious disease, and control measures should be used to protect you from these airborne infection. You need to have isolation, respiratory protection. Now, warning, like I said, warning, even they're saying it, surgical and other non-respiratory face masks do not protect persons from airborne infectious disease and cannot be relied upon to protect you from the novel virus. Just like I said, N95 or greater. It has to be fit tested. Everybody can't wear the same mask because it has to fit your face to ensure that no airborne particles are going to get under your mask. This is the surgical mask. This is not going to help you. But when your patients come into the hospital and if they're under investigation, you definitely put this on them to help keep them from coughing and spreading it. It'll go into their own individual mask. So there is a distinct difference. Now, surgical and face masks must be used instead of any approved respirator. You have to use the respirator. We call these respirators. These are masks. So anything under 95 are considered masks. These are respirators, which is approved to fight the coronavirus. Cal OSHA regulations require protection for workers exposed to airborne infectious disease, such as what we have right here. Employees and workers in health settings, it is very important to prevent the virus from spreading. So it would be very unfortunate that if we don't have enough N95, that we're actually helping to spread the virus. We're going to be taking it home to our families and in our community. So we must have these particular masks. So if you don't need it, don't buy them. The nurses need these, and the doctors need these. We need them to take care of you. So appropriate measures should be maximized to respiratory supplies to reduce the need of respiratory demand. So everyone in the hospital, if you're not on the unit that has these respiratory isolations, then you should not be going out snatching up the N95 masks. You should let the nurses that are there and the doctors use the N95 masks, because we do have a shortage. So only people on those units should have access to those N95 masks. Also, if they're triaging coming through the ER and different things like that, there's designated areas in the hospital that should have the N95 mask. I was online looking for N95 masks, and there's none available. I was on it for almost 2 hours. And the ones that were available, I saw prices all the way up to $650. So people are taking advantage of what's going on and the hysteria that's going on in the population because of the coronavirus. And I think that should be just so illegal. So be careful when you're out there trying to purchase supplies. State, local, public health departments can help provide respirators to healthcare facilities when the inventory is low, meaning that you have to provide it to the appropriate staff at the time. So what the facilities should have done is they knew the virus was coming. They should have stockpiled enough N95 masks and shields, because we're supposed to have goggles. If you're taking care of a patient, you have goggles, you have a face shield, which covers both sides of your face, your N95 mask, you have your gown, and you have your gloves. These are the protective, we call them PPE, personal protective equipment. This is what should be going on, and this is not happening. Now, so it's up to us to help with the conservation of the supplies, but management has failed us. They failed us because they didn't stockpile enough PPE. And I don't know what they were waiting for, because we already had it in China. So what was the big wait for? They wanted to wait till we had a case here in the United States and we start having deaths. Well, that's too late, because now people are having hysteria and they're buying all the N95 masks, and we don't have them available. Now, isolated cases that once they come to the hospital and they're admitted into isolations related to respiratory precautions in the hospital. So those particular nurses will be needing all of the equipment that I mentioned to you in order to take care of that patient. Now, those are at the highest level of precautions and isolation. Limited people should be entering those particular units, and they should not even be on the floor. So it should only be the people who are in those areas. Now, they also use airtight windows to eliminate workers' exposure to the airborne infections. Now, there is some non-airtight barriers that happens, like with the reception booths. It happens with the information booths in the ED. These in triage sections where the nurses are. These are some barriers, but it doesn't prevent the spread of the coronavirus. So I just want to make sure, just because people think that they have that barrier there, that they're safe. They're not. Remember, it's aerosol. Aerosol particles are very tiny, and they do travel. Now, if there are patients on those floors, make sure you limit and don't go into those rooms or those areas unless you work there. Those particular employees must use the respirators for their patient and not the surgical face mask. Okay, that's not going to protect them at that point. Now, administrators could use control over the supplies, but what they're doing is they're holding the masks and then just distributing them out because there's a shortage. Like I say, our medical professions managers have failed us because they didn't order enough supplies. They didn't stockpile them, which is really sad. Okay, so now the other thing is whenever you're in a setting, there has to be the proper cleaning of those rooms. That means the housekeepers have to be trained. They really should be fit tested as well, because they need to have the proper equipment if they're cleaning up. If they're cleaning up and stirring up stuff, they need to be protected. And the housekeepers are not being protected as well. They need to be trained. We all need to be trained, even the nurses, because this is a whole different animal. So we need to all be trained on how to darn the proper personal protective equipment. We also need to know how to make sure that we're comfortable with that in order to take care of the patients. Now, if there are unnecessary appointments, then by all means, if it's elective, some of those surgeries are going to be canceled. They only want the necessary or urgent surgeries or appointments to come into the facility. We want to limit the mass influx of patients into the ERs unless you're sick. But if you're sick, remember, you have to call ahead of time so that the staff can prepare you before when you get there, so you don't expose other patients and other staff to the coronavirus. So it's very important, if you have symptoms, then you can call ahead, but don't just go in because you feel like, oh, I better go check. We also have a shortage, remember, on the test kits. So they're only going to test right now until they get enough test kits on the ones that are really showing the symptoms. Now, you have to remember a lot of this is contact as well. So if you're touching something that's in the room or outside, make sure you're washing your hand at least 20 seconds or more. With the kids, you can sing Twinkle, Twinkle, Little Star. Gloria Gaynor is now on the internet singing I Will Survive, and that's giving you enough time to wash your hands. You can also sing Happy Birthday twice. That'll give you enough time to wash your hands. You have to make sure you're washing your hand very thoroughly. If you're out, then you have to make sure that you have your hand sanitizer, you're washing your hands, touch as less as possible. Try not to go out. We want to decrease the people going out to decrease the chances of the coronavirus. Now, there's alternate methods to work in different healthcare settings. So we're waiting for our Department of Public Health to give us all the appropriate ways to triage and assess our patients. There's also different methods. There's alternate work schedules. There's telephone screening or video calls. There's different ways to have appointments and assessments completed. And our department needs to step up and have those options for us as well. There are policies for the different respiratory protections, but if there's going to be changes, it needs to be consultation with the actual boots on the ground, which is us nurses. We spend a lot of time with our patients. We're going to take care of you guys because that's what we do. But they shouldn't change policies and implement plans without consulting with the nursing staff that's going to be doing the work. This is when we have delays in the appropriate type of plans, which exposes the healthcare workers to more exposure to the coronavirus. So we have to do it appropriately, and we have to include the boots on the ground. We have to also include everybody who's involved, whether it's the clerks, the housekeepers, everybody on that floor that has contact with those clients need to be fit tested for N95 masks, and they need to be trained on how to use those things. That's what's supposed to happen. It's not happening, but that's what's supposed to happen. Now, another thing is you should not be reusing your mask. It's not healthy because, the N95, even N95, it's made with firm type of material, but they can get wet as well, and then that's not helping you if it becomes wet. So you shouldn't keep reusing your mask. The one mask that you can reuse is called PAPR. P-A-P-R. That one is it has a full face respirator that covers your whole face, your head. It is It powers in air to purify the respirator. So it's a powered air purifying respirator. That's the PAPR. Okay, and that one has the holes in the back. It has a battery operated device that's attached to it to keep that purified air circulating so that you don't get exposure to the aerosol particles. The respiratory filter needs to be replaced periodically. Now, you also it has to be clean after each use, but it can be reused with other staff. It's more expensive, but it is a way to reuse masks. It's a certain protocol you got to follow based on the manufacturer guidelines, and it takes anywhere from 20 to 30 minutes to clean the respirator in between uses. Now, the only time that you can't use it is if it becomes contaminated, with bloodborne particles or any other particles that's coming from the coronavirus patient. So you have to follow the instructions for the manufacturer on how often you need to change the filter within the battery-powered purifier. And also you have to follow the strict guidelines for cleaning the device. So like I said, you can use this one for longer periods of time, and you can use it with different patients because it's ongoing purifying the air, and it's not going to get wet like the N95 one will get wet. So it's a safer way if you have a shortage to get several of these different devices so that the nurses can use them. Employees must establish procedures and provide effective training to ensure that the respirators are kept clean, that they're sanitary and in good working orders at all times. Now, it's up for the different facilities to train everybody to make sure they get proper training and make sure that that person is comfortable. It's up to the nurses to decide if they're comfortable with the training and feel comfortable doing what they need to do. We did develop a little script, and what we said is that like if you're uncomfortable, so you need to state, I need to be trained and competent, meaning how you feel that you're competent in order to complete a task. Now another one is, I need all the appropriate PPE in order to do the task. If you don't have appropriate PPE based on CDC guidelines and also Cal OSHA to do the task, then you're endangering yourself and the patient. Then the final one is, without competency and training and the PPE, you can state it is not safe for me to appropriately complete the task. It's not safe for myself, my patients, and the community. So this is something that was developed by our union, SEIU 721, with us. We are the union nurses, so SEIU is us. We are the union. So the nurses helped develop this script because we had nurse managers subjecting nurses to coronavirus patients without all the proper PPE. So this is something that you guys can state that will help support that will keep you safe, your patients, and the community safe. So that's the script that you can say to help yourself while this coronavirus is going on. Now, the other thing I wanted to let you guys know, to not panic. Like I say, you can order online as well. If you go to the stores, you're going to be waiting for hours, and there's really nothing there anyway right now because everybody has this mass hysteria. So they're buying up everything in bulk, which leaves a shortage for everybody. I mean, it's too much of a mass hysteria. But we have to protect ourselves We have to take care of our clients, but we want to do it in a proper fashion that we're not endangering our clients, ourselves, and our family and our community. So as nurses, we're going to always take care of our patients. That's just what we do. We just need management to step it up and develop a plan that keeps all nurses, all staff that are in hospitals, that are in clinics, that are making home visits, that you keep us safe. If you're going to be making home visits and they recommend that you screen, of course, we're going to do that to see if the child is sick or not, or anyone else in the home is sick. So you have to make sure you use that extension. Is anyone sick in the home? Because you want to cover everybody that's in the home. Because sometimes we have multiple generations, and sometimes we have multiple different families in the home. So you have to make sure you ask the question for everyone who's in the home, is anyone sick? Now, if they need to be assessed, then you can direct them to go to their provider or call the ER, but call ahead so they can be prepared for them. Then you can reschedule the visit, because we're, like in my job, I'm working with social workers, so we have to help protect them as well. We're all got to be protected. Children, the family, everybody. So if they're having the symptoms, I sent the family to the emergency room at Harbor UCLA because they didn't have the Medi-Cal. If they don't have insurance, you can always send them to a county facility. But you still have to encourage them to call ahead so that that facility can be prepared, meaning wearing, make sure they have on their masks, their gloves, their gowns, face shields, goggles, what they need to take care of that client. Because even if a client is under investigation, that's what the nurse should be wearing. She should be properly donning all the personal protective equipment, the goggles, the face shields that cover the face, the mask, the gloves. All of those things should be provided to that nurse in order to do the proper assessment. So nurses, you have to stay safe. You have to take care of yourself. And if there is problems, there's a way that you can document those problems. Like I said, these are Cal OSHA and CDC guidelines. There are complaints you can do to Cal OSHA. You can call it in. You can do it online if you're not feeling safe. Because the bottom line is you have to be safe. Now, as far as the family, how you protect yourself, make sure you're washing your hands frequently. Try not to go out and, like I say, use social distancing. Even though you have kids that are young or young adults who think they may not get the virus, they could be carriers to you. And if you're more vulnerable, if you're 65 or older, or you have the different complicated medical diseases like diabetes, heart disease, lung disease, all of these different things, then you need to take precautions. So just sit your children down and talk to them. And sometimes they're hard-headed, but you still got to keep telling them the same thing so that they don't put you in jeopardy. So at first we thought we had one child that had the virus, but then come to find out the test was faulty. So we did have some of those incidents in the past where some of the tests didn't have the proper preservative for the test kit, so the test was invalid. So then they had to retest. So I heard also that they're running out of the agent that goes into the tube, so then that's a problem. So we need to be on it and get all of this stuff produced. And it's unfortunate because 80% of the medications come from China as well. So I'm waiting to see if we're going to have a medication problem. I hope not. But we should have somewhere in America where we're making medication. No one country should have 80% of anything that we have to use every day. No one country. Also, they were making a lot of the N95 masks, and so we should have it here in America. Like they said, made in America. We need to have more stuff here made in America so we don't have these shortages. These are the things that we need to take care of our clients. Management should have stockpiled the different PPEs, protective personal equipment, so that the staff, when they needed to roll in there and take care of the clients and the patients, we have what we need to take care of them. So again, a lot of the news reports, they're staying away from saying it's aerosol when it is. They're trying to say it's just large droplets, meaning if you sneeze or cough, it lands on different surfaces, or you touch things after you cough in your hand, and it's not, it's aerosol, it's small particles too. Why else would it be spreading so fast? So if the CDC and Cal OSHA are saying this, why isn't our manager saying that? It's just like, it's the reality of the truth. So you have to protect yourself. Make sure if someone is sick, please stay home, because you're going to make that person sick, and then it's going to make them more vulnerable to the coronavirus. So if you're sick, stay home. You have to make sure people are using the proper etiquette, respiratory etiquette. So teach your children, teach your family members, if they're coughing, to cough in the inside of their elbow, cough in a tissue, make sure you throw it away and washing your hands. Don't shake anybody's hand. We usually do now elbow taps, so there's no handshaking. So please don't model after Trump, because he's doing all the wrong type of techniques. We have to do the right type of techniques. We have to make sure that we're washing our hands as frequently as we can. Because when you touch, even your phone, now we touch this over, they said about 250 times a day. So if you're picking and touching things up, make sure you clean your phone every single day. So you can use clean with a little bit of Clorox. You can mix it. Usually it's like, I think 1/4. Usually it's 1/4 per water. So you can wipe it down. Make sure it's not wet, because you don't want to do that. Or you can take some of the wipes, if you have them, and wipe it down. Or you can use, because you don't want to get it too wet, because then you'll mess the phone up. But you can wipe down your screen, wipe off the back. It doesn't have to be like really, really wet. You want to wring it out really good so it's not wet, and then dry it very quickly. So just remember, these cell phones is a huge problem as far as contacting germs. So we have to clean this. This is touched 250 times a day. So make sure you wash your hand and clean your phones as well. So anything in your home, clean your doorknobs, clean your cabinet knobs, anything that people are touching frequently, your toilets in your bathroom, that's most frequently used as well. So you want to make sure you're wiping those things down before you just keep retouching them. But now they're having a lot of social distancing. Like I said, that they are closing different things down, including the basketball. I mean, a lot of people wanted to watch basketball, but even Rudy Gobert, I know I'm screwing his name up, but there's 3 different basketball players that have coronavirus. And I'm pretty sure there's going to be more to come, just like any of us. So like all the top doctors are stating, it's going to get worse before it gets better. So just know that, because a lot of people are not being tested because we have a shortage of test kits. So once people are now going to be tested, you're going to have more people that are going to come positive with the coronavirus. So just know that's going to happen. So now what we're trying to do is try to minimize the problem. I wish we would have took these actions a little sooner, but right now we're behind the 8 ball. So you have to protect yourself. And the other things I would suggest to you is make sure you get plenty of sleep, because when you're not sleeping well, it throws off your immune system. So get plenty of rest, plenty of sleep. Make sure you turn off the TVs, and even if you're not sleepy, turn it off. You want to get used to the darkness, and then you can go to sleep. Have your kids get off the devices. I know parents, it's going to be kind of frustrating because the kids are with you every day, but you just have to find activities for them to get into, movies to watch. You do table board games. A lot of stuff we used to do before we had all this technology. It'll give you time to spend time with your child and talk more to your child, see how things are going on at school, what's going on with them. This is a chance, an opportunity to help you increase the relationship bond with your children. So take all these opportunities and utilize them. Make sure you're teaching your kids how long to wash their hands and how to wash their hands. They have to make sure they wet their hands completely first. You have to make sure you have friction with soap in between their hands, on the back of their hands, inside doing rubbing, really friction a lot. Make sure like you cut the fingernails. I cut mine down. You want to keep your fingernails low because fingernails harbor bacteria. So you want to make sure when you wash your hands, you're cleaning under your nails as well. So practice with your children, because it takes at least 3 times or more for someone to finally get something that you're teaching them. So you're going to have to do it several times a day. They have to wash their hands several times a day anyway. Now, I witnessed, unfortunately, women that go to the bathroom and they come out and they don't wash their hands. That is just really terrible. So make sure you teach your children after they use the bathroom, wash their hands. You might want to go with them to ensure they're washing their hands properly. Because some kids will turn on the water, rinse it, and they're done. And that's not it. You need to supervise your children to make sure they're properly washing their hands. And so should you. You should wash your hands frequently. So the amusement parks are closed. The libraries are closed. The sporting events are either delayed or canceled for the rest of their seasons. There's restaurants that are closing. There's small businesses and large businesses that are, either cutting back or going to close. So everywhere you look, they're shutting down. Why? To decrease the exposure so that people are not getting exposed, because it's aerosol. It's not just large droplets. It's aerosol. So if I can't stress that any more than I have now, you have to make sure that everybody is getting the correct information. So protect yourself. Like I said, make sure Okay, so as I said, make sure you take care of yourself. Make sure that you're washing your hands frequently. Don't panic. It's not a good idea to be in the lines in the stores for hours next to somebody. You need to keep that social distance of 6 feet. If you're sick, don't go to the stores. Don't go out. You're making other people sick. Have someone else go out in your place instead of you. And like I said, if you do have the symptoms, notify your doctor ahead of time or the ER ahead of time so that they can prepare for you. So I hope this was helpful. I just want you to know the seriousness of this and how we're contracting it even more, even with talking and exhalating, not just droplets. So you guys take care of yourself, stay healthy, go to the CDC website and Cal OSHA. You can read all the complete details for yourself. All right, I'll see you in a week or two. Okay, bye-bye. Have a good one.